Hello and welcome to another episode of Business and Bubble Tea. Here on the podcast, we have with us today Sudharsan Srinivasan, the Managing Director of Meindoc GmbH. Sudharsan, it's great to have you on the podcast with us today.
Thank you. Thank you for having me as well.
Welcome to Business and Bubble Tea. And can we ask you a little bit more about Meindoc and what's the mission of this company?
So at Meindoc, we let the surgeons create personalized surgical video for their patients. So I think before even talking about Meindoc, I have to talk about the problem. Why Meindoc and how it started.
What's the problem you're solving?
What's the problem you're solving? So at Meindoc was founded by two urological surgeons, and they were finding it hard to provide materials to their patients. And they had a case where one of the patient dropped out of surgery because of fear of surgery and unfortunately passed away, and that had a huge impact on them. And they were trying to solve it to provide a better materials to the patients. And when you usually find yourself try to find a solution in Google, you always end up with the wrong material, which in turns would cause more fear rather than solving the problem. And the doctors, they were trying to draw it in a paper and show it to them. So it is hard for the patient to visualize the organ as well. And worst case scenario, if they show a video from the previous surgery, it is even more scarier to see the blood and flush. So, and the videos that are available online, they have to stitch multiple videos together, prepare they end up spending a lot of time preparing materials for the patient. And that is when I came into the picture, and we created a tool with which, with a few click of a button, the surgeon can explain the problem in using 3D. So for example, if somebody has a kidney stone, the doctor can place a stone in a 3D format, show it to the patient. This is exactly your kidney looks like, and this is where the stone is, and how it will be removed. What are the surgical procedures used?
Does it have a consent component as well to it?
Yes. So once they, with a few click of a button, right? So where the stone is, how it will be removed, what are the surgical procedure that they're gonna follow, and all these things based on the questions and the 3D input, our cloud solution will generate a video and then give it to the patients in a format, with 3D format, consumable format. So they have a better visualization, the patients, and it saves time for the surgeon basically. And it is also, like you said, helps them with the legal consenting process. So that's what we do at Meindoc.
And can I ask, so a few companies we've interviewed, I guess, have been more involved. They've been health MedTech startups as well, and they've primarily focused on the UK market because the NHS is such a big kind of client to tackle. You're based in Germany. Yeah. So what makes that environment one that you think's, I guess, most appropriate for your solution?
See, one, we are based in Germany because the surgeons are from here, urologists. They were practicing in Germany. And the second thing is, similar to NHS, they also have a very good healthcare system in Germany. And I come from India, so when I came here, the thing I noticed about the healthcare system and about the digital healthcare system particularly, it's really exciting to know because as per the DIGA, the insurance company have to reimburse for the digital apps, health apps, and that is where we fit in. When we did the clinical study, we proved that this app is reducing the pre-surgical anxiety of the patients. Thus, we get into the DIGA system, and the medical insurance could reimburse the whole cost for us. So that makes us very exciting here to be here in Germany.
And I'm just going back. Sorry, Roberta, go on.
No, I was thinking you also assist patients in the post-surgery treatments, right? How do you do this with the 3D technology that you use?
It's a pre-surgical anxiety. That's what I said. Pre-surgical anxiety.
Yeah. Okay. So go on, sorry.
Do you assist also after the surgery as well?
After the surgery, we have a pipeline to continue it after the surgery as well. But currently it's before the it's the consulting, that is where we fit in now. And post surgery we have the medical reminders and all those things, tele support, that is there in the pipeline, set to launch.
And just taking a few steps back, you've also founded a sort of a Dario Games.
Mm-hmm.
How did you make? I guess how did that journey start, and then to here? How was that? How does that transition work? 'Cause you've gone from sort of games, from what I can see, to
MedTech.
MedTech. I just trying to understand that journey, because I think it's a super interesting sort of move.
Okay. So I studied gaming. I did my undergraduation in gaming. I studied BA in game design. I was making games before, like I said. That then slowly after I started making products out of game rather than making games. So I was making. So I called it as an entry to metaverse. Before metaverse became a thing, I made virtual spaces for brands, customization solutions,
Yeah.
where the people could customize the walls, furnitures, and augmented reality assisted e-commerces and all those services. And I worked with Fujifilm in Canada, where I created a internal tool for them to educate their, it's a ultrasound slicing machine. So I created a tool that, I guess that is my first medtech project, I would say. And
Yeah.
then slowly this thing got interesting, and purely based on the surgeons that I met. So when they talked more about the problem, where I could apply the knowledge of gaming here.
Are you?
So
So you're talking there about Pixels Mega, right? The
yeah, Pixels Mega. Pixels Mega is the brand that we registered to cater to the clients in Canada. That through Pixels Mega, we worked with Fujifilm, and then we created virtual spaces there. So Pixels
and
Mega, it's another spin-off from the Real Games, with the core team and another co-founder from Canada. So that is where we created those services. So the whole metaverse thing, right? When it becomes so whole virtual, the creation of AR technology and the virtual spaces that were branded under Pixels Mega and launched it in Canada.
And are you planning to apply these also to Meindoc? So like metaverse or gaming, this kind of
So Meindoc got more exciting when we start about medical metaverse, right? So I also worked with some brands in US where I created digital twins for them. So all those experience of working with different medtech sector are helping here in Meindoc. So AR assisted physiotherapy and AR visualization of anatomy to the patients. So all those things were there. We are testing. So we have some prototypes done, but we have those for the pipelines. And I still feel that the market is still not ready for the metaverse thing in a full-fledged manner. Technically, it is exciting for us to do all kind of experiments, but as a product, we will be launching it later on when the market is ready.
and what do you see? Because going forwards, in terms of, I guess, the synergy between metaverse and healthcare, what do you think is the next sort of trend that you're seeing?
I would say I bet more on the digital twins, right? Running all kind of tests on your digital twins, practicing the surgery, all those things. So that I guess that is more exciting for me than this, because so here Meindoc, the basic one that we have is we generate a video. So it is very personalized for the patient, and then this could also be applied to a digital twin in future. That is for how we
Yeah.
set up our pipeline. So here you tell the patient this is the tumor is, and then the next step of Meindoc would be doctor performing a surgery on it, practicing it.
And I guess what have been, because healthcare is obviously a very heavily regulated industry. What have been some of the challenges that you've experienced trying to get Meindoc off the ground? Because
Yeah.
I'm sure there are a few.
Luckily, I found a consultant who helped me throughout the process,
Yeah.
CE and setting up the QMS and thing. I would say we started bit late because we were so creative in solving the problem, and then we kind of skipped about all those things for a few months. And
Yeah.
then when the consultant came in, we had to redo a lot of things. in a very structured way. I mean, yes, you can be creative, but you also have to, think within the framework, how you deliver it and how you process it. And it is a very challenging experience for someone who is from a very creative background to fit within the framework.
Yeah.
And since this is also a software as a medical device, and most of the questionnaire in the regulatory were focused on the physical device, so it was always confusing for me, and then I always keep writing more context to it. This is a software medical device.
It's
So
software, not a physical thing,
not
really,
that.
is it?
Yeah, yeah. So yeah, that's a very good experience. I would say that now the way I think about, even when I talk about the digital twin and all those things, um, in the brainstorming session itself, I have all these regulatory factors in mind now. So that helps me going through the process, help me better create new products, I would say.
And for the future, are you planning to expand in other countries, or do you see also maybe other countries more ready to accept this medtech and like metaverse um,
Yeah, we are
creation?
actually expanding to India as we speak. So there are some hospitals who are already using our product. Very, very good feedbacks from them. But the sentiment is different from for different countries. How the insurance works, and the whole thing is different. It's exciting to solve those problems as well. The same formula doesn't apply for different countries.
Hmm.
So that's also very exciting for us to work on it.
And in terms of, I guess, area of focus for your sort of solution, obviously there's thousands of different types of procedures and operations and areas to focus on. How have you just divided up the focus of Meindoc in terms of the solution you're providing? To which sort of groups of surgeons, from
Okay.
which sort of departments are you looking towards more?
So the next, so we completed urology. So urology because purely because the surgeons were the founders were urologists, robotic surgeons, and we had the knowledge base there. Because it's not only 3D artists and stuff, you also need a lot
Mm.
of input from the surgeons. So they spend plenty of time correcting it and getting them to coordinate with a 3D team, getting the output. So it's a part of the facts as well as the storytelling, how well you tell the story, and it has to be correct as well. That was a challenging experience we've gone through, and being them as a urologist, that helped a lot. So we focused on urology first, and the next one, based on the data that we have, we are going to go with cardiology, then
Okay.
orthopedics, then gynecology. I would say I would like to add one more point there. Collecting a medical data, how many surgeries are performing worldwide, it's a huge task. You don't
Yep.
get a right data. Only in UK and Germany you get to the point exact data.
Yep.
So we prioritized, being a German company, we prioritized on the data, which surgery is happening, why gynecology, because why cardiology, because these many surgeries are happening, we have availability of the surgeon. That is how we pipelined it. But to do the same for other countries, it's so much, you don't get the data, proper data.
And what nuances exist that you see in terms of taking your product to, say, you've launched in Germany and now you're taking it to India? What nuances are you seeing in terms of difference of trying to move to different, I guess, medicine in India versus medicine in Germany?
Come back again, sorry.
So, what differences are you seeing in terms of accessing the medical space in India versus in Germany? Like, what's different about doing business in medicine there versus in Germany?
Uh, See, one thing I would say that how they would pay for it, right? So in terms of insurance covering it in Germany, it's very straightforward. There in India, you have different types of people from, and the hospital, the class of hospital is also different. The target group for the hospital itself is different there.
Yeah.
That is one. And having a right price point, it makes a lot of impact there. And also the way you approach and how you protocol it. So whether the hospital makes this as an mandatory or do they give it as an option. In some cases, even if it's a life-saving medicine, you give it as an option in India, it wouldn't work out. They would simply choose to ignore it because of the pricing factor. So yeah, it's a huge difference there between
Yeah.
these two markets. And like I said, right, it is exciting to solve one by one those things.
And has it been I guess difficult convincing doctors to use Meindoc, or because I guess in at least in the UK it's a very sort of conservative system in a way.
Uh,
And particularly with sort of healthcare, something that works they don't want to change, right? so and I guess in a way all this sort of online healthcare and that sort of stuff as well has been very much pushed by the sort of pandemic that's kind of forced change. What kind of pushback have you had?
So we actually are in the fourth iteration of our tool. Initially, we were collecting a lot of data directly from CT and MRI. We were trying to scan it and then get the data from him, and then we gave a 2D blueprint and then asked the doctors to pinpoint it. And so it took us a lot to get there. One is availability of the doctors was hard for us to reach. They don't have enough time to spend with the patient, and then when we are co-creating a product, it was hard to get a lot of feedback from them. One, and even before you go give it to the patient, you have to do a lot of trial, right? In MedTech, you cannot just give a half-baked product there, and so you have to complete one version, go to the
R&D
doctor,
is
test
probably
it,
quite,
yeah, and doctors always believed in this because there is a every doctor goes through this, right? So when it is helpful, they also believe they've been very supportive as well. It is just the time. It was hard to reach out to them for between the appointments. It would take a lot of time and all those stuff. But when they do, they actually give full commitment and then give a lot of good feedbacks. What exactly the patient feel, how we could improve them, and all those things. And it is really needed for all the doctors that I spoke to. At some point, they crossed this, they faced this problem, not having enough material to provide it to the patient, and it really worked. It's not so hard for us to convince the doctors to use this. It is a problem of convincing the hospital to do this. Why
okay.
add this to them?
And considering
So I guess
the patient,
sorry, Roberta, go.
considering the patient point of view, do you have any successful story to share with us of patients that maybe were experiencing this anxiety pre-surgery and they actually with your service could remove this and actually go through the surgery?
Yes, so there is a patient in India. His mom was having a kidney stone, and then they wanted to operate it, and they were very scared about the surgery. And we created the video. I would say that was one of our first patient that we did while we were doing an R&D phase, right? So when you are in R&D, you tend to think whether it works or not, and that case is what gave us a boost to proceed it further in a full swing expand to the surgery. So they were really scared, and we gave the video to her uh, to convince her for the surgery, and it really worked. And the whole family appreciated about the video, how it helped them. It's not just her, also the family. Her son was shit scared for her, what would happen and all those things, seeing her mother scared. So that really had a huge impact for us to get it further. Recently also we got a feedback from a hospital in Bangalore, uh, uh, so where one of the patient got a video for prostatectomy, how it does
Okay.
and where exactly the tumor is, and we got a feedback from his son appreciating the doctors to provide this video, and we also got a feedback and a video testimonial from them as well, how it helped it.
And I guess we've got time for one final question. I just want to ask, what advice would you give to anyone looking to get involved in the medical technology field? Maybe not necessarily from, I guess, medical background.
I would say that learn about regulatory process first before getting creative.
Navigate the boundaries, I guess. Yeah.
Exactly. So that is one advice that I would give, and I see a lot of people in medtech who don't give enough importance to the regulatory frameworks and getting far ahead with the product and then not able to get into the market. So that is the one advice I would want to give, to know the regulatory framework.
And I guess I just have a quick question now, actually. And what excites you most about being involved in medical technology rather than just pure tech?
I have to be honest. The tech is the most exciting part for me,
Okay.
and the problems are so complex here, and solving that problem gives you more. What do you say, that kind of I didn't know the right word for it. The excitement or
Yeah.
that kind of adrenaline rush.
Satisfaction or
Yeah, satisfaction. Uh, I got to work with I had an opportunity to operate on a robotic equipment. It was a fantastic experience, I would say, till now. Being a gamer, I was able to play around with this joystick. I thought it would be simple, but imagine peeling a grapes, the kind of precision it takes, it was amazing. So, and the problems around it are so exciting for me to solve, I would say that. Basically, applying knowledge from a different domain in MedTech and solving a problem, that is beautiful, actually. I think somewhere I feel like I have a purpose, more purpose, applying this knowledge here. Yeah.
Well, you can also help people, so it's really,
and the side benefit, saving people lives.
yeah.
But
exactly. That's kind of their overall game, right?
Yeah, I mean, one of the surgery we've done another experiment. We created a overlay, a 3D overlay when doing the surgery, and it kind of saved a patient organ. That is again super exciting thing for us. We kind of gave a depth vision when they were performing a surgery using the 3D models, and they were able to, because when you see it in an endoscopy, you see only that, first 2D area of it. You don't know what is behind the organ. So when we superimpose the 3D organ on while they are performing surgery in a real time, they know exactly where the artery is, tumor is, and they don't have to remove the whole organ for it. So that kind of saved an organ. That is another story there. That is really, saving an organ.
Well, Sudharsan, that's all we've got time for today. But thank you so much for joining us on this.
Thank you. Bye.